How do you build a $78 million healthcare operation that serves thousands of families in their most vulnerable moments and do it with compassion, innovation, and sustainable growth? You ask someone who's been doing it for 40 years. Linda Ward has been calling the shots in hospice, palliative care, and home health since before most of us knew what a strategic growth plan looked like. And today she's opening new care centers, driving innovation, and proving that heart and business excellence aren't mutually exclusive. Welcome to the Policy Playbook. I'm Misty Carson, and we're about to learn from a true veteran. This is smart strategies, straight talk, zero BS for protecting your business and your people. I'm your coach. Let's get to work. Today's guest has been playing at the highest level of healthcare leadership for 4 decades. Linda Ward is the president and CEO of Gulfside Healthcare Services, and she's not just running a business, she quarterbacks a $78 million operation that touches the lives of thousands of patients and their families across Tampa Bay. She's built Gulfside into a powerhouse, providing hospice care, palliative care, and home health services with a level of compassion and excellence that's become her trademark. But here's what makes today's conversation so valuable. Linda's not just maintaining what she's built, she's expanding. New care centers, new service lines, new innovations in how care gets delivered, and she's doing it all while staying true to the values that got her here in the first place. Linda's also a sought-after speaker and thought leader. She presents regularly at national and regional healthcare conferences, and she served in leadership positions with the National Hospice and Palliative Care Organization, the Florida Hospice and Palliative Care Association, and the Hospice Action Network. Today, we're diving into her playbook for sustainable growth, leading teams through expansion, managing risk in a highly regulated industry, and building something that lasts. Let's get to work. Hi, Linda.
Hi, Misty. So nice to see you.
So nice to see you too. I always enjoy our time together.
I do as well.
You're so bright and just like this, your energy is just amazing. So thank you so much for being here. I have been super excited about sharing your work because I love what you do. We talked about this before, but I've had family members who have utilized palliative care and hospice services, and it was an amazing experience for us and for our families. And I feel like it could definitely go either way.
Yeah,
scary.
It is scary. And, you know, the key is being there for people. And you said it in your intro. It's about compassion. It's about passion. It's about loving what you do. I love what I do. And, you know, I love the sports playbook. It's all about teamwork. I could use a lot of sports analogies if you want today because I love every sport. And so that's really the key, I think, is just really building a great team, but supporting that team as they grow and take us along the journey.
I love that. I think the teams are so important. So tell me about your business and how did you get in this game?
So our business is Gulfside Healthcare Services, and it is a continuum of care approach to either pre-acute or post-acute services. So for people who have either been in the hospital and need services following that hospital stay, or preventing hospitalization through the 3 lines of service: skilled home health and rehab, palliative care for chronically ill, and hospice care for late to end disease.
That's amazing. Has it evolved over time, or was it always those 3 particular segments of care?
Hospice care has been around in this country since 1976. Palliative care is still a really rather new part of the healthcare industry. We actually took 2 years to get our Medicare certification in 2007, and I believe palliative really was just coming on the scene somewhere around 2005, 2006. Skilled home health has been around for over 30 years, and it's really, the market is very saturated with skilled home health and rehab agencies, but there's so much in this Tampa Bay market that I think all 3 of those service lines within healthcare are going to be well provided to people here in this Tampa Bay market.
That's super exciting. Lord knows that we need it.
Yeah.
How has your business changed in the last 3 to 5 years, and what was working then that doesn't work now?
So I would say the business of hospice care has changed in that the market for hospice care has changed, especially in this Tampa Bay region. There used to be monopolies serving one area, and there was no competition. And hospice is not a free market in the state of Florida. We're one of 15 states that has a competitive certificate of need process, meaning you cannot just start up a hospice if you feel like it. And it's really challenging for a provider like ours where we know, we could expand anywhere throughout Florida and serve with the excellence we have. So instead, we must wait until a service area is really not serving the needs of that community, meaning there are more patients that are dying without hospice care that qualify for hospice care. And so when that happens, the certificate of need opens up. It's highly competitive. And for instance, we applied for the Hillsborough certificate of need with 9 other providers.
Wow.
And 1 provider wins, and we did, and we're very excited.
Amazing.
And the same thing with Pinellas County. So we had to wait until that certificate of need opened up. And so that's what's very different. But in the same token, it's challenging because waiting for that certificate of need to open means that people are, without services until that happens. The other thing that's changed is the regulatory scrutiny. It is just so laborious, and a company like ours and all healthcare organizations have to hire more staff just to be able to stay on top of the internal audits, to be prepared every day for external audits, surprise visits by regulatory agencies, so that we prevent fraud and that we remain highly standardized and compliant. As a matter of fact, the Joint Commission walked in yesterday on a surprise visit, and we're under accreditation, and we didn't know they would be here, but we're ready.
Wow.
So it's just highly scrutinized.
I had no idea that it was based on need and you couldn't just open up a hospice care.
Not in Florida.
You said it's that way in 15 states.
Yes.
And Florida is one of them.
Right.
And I wonder what legislators were thinking when they decided that.
Well, because the skilled home health side of healthcare became so market saturated, there were so many providers, it confused physicians and healthcare referral sources. It confused the public, right? The community. Who do I use? Why are there so many? And then there are states such as Texas where in a 30-mile radius there might be 50 hospice providers, and they might all have 20 or 30 patients. To be able to really provide a comprehensive company, to be able to exert the resources needed and hire the right people, having a small hospice organization, you just don't have the resources to do that. So the legislators here in Florida, while every year the CON is typically on the docket, there's enough legislation that supports the certificate of need. The CON for hospitals, that went away about 5 years ago in the state of Florida, and now there are hospitals popping up everywhere. And so I support the certificate of need philosophy, but I truly believe that there still are many patients that are going without hospice care. And so we just really want to penetrate as much as we can in the Tampa Bay market, serve as many people as possible that need our service.
Yeah, I love it. Everything that you do. I loved your candle lighting ceremony that you had.
Yes.
I bought a candle in
You did?
I did, in memoriam of my dad, and
Wonderful.
who passed away from COVID. And he was not able to receive the care that he needed, and it took a while. He was sick for a while, so it was so beautiful, though. I love that you do that. It shows that it's not just a business. It truly is about who you're serving, and that my sister and I were crying, holding hands together.
Oh, I'm so glad.
Yeah, it was beautiful.
Our memorials and bereavement programs aren't just for people and families who have experienced services through Gulfside. It's for the whole community. It's for anyone that calls us, anyone that, really wants to honor someone and memorialize someone. So I'm so glad you attended that. That's
was
wonderful. Thank you for supporting Gulfside and doing that as well.
Yeah.
And I'm glad you were able to get something from that.
Thank you. Yes, it was beautiful. It was something my sister and I were able to share together. And I was in Michigan at the time when it happened at my sister's house. So it worked out really, really well. So speaking of growing, certificate of need, everything you have to go through to expand and the need of our community, moving into Hillsborough and then moving into Pinellas next. What's your biggest challenge right now as you're trying to grow?
Yes. So as you said, we won the certificate of need last year, and we launched Hillsborough on August 18th. And the biggest challenge with launching, once you win the CON, and even if you're opposed by competitors, which happens, it takes a while to work your way through the agencies to get that license. So it literally took about 6 months. While patients are still waiting for hospice care for other providers, you're waiting to go through the regulatory process. Once the license is in hand, you're good to go. So that was one of the challenges. With Pinellas, it was quite different, and we actually started serving Pinellas County yesterday.
Oh, that's amazing.
And so I think on our
Congratulations.
first day, thank you. I think on our first day we received 12 referrals
Wow.
alone from different providers. But it was a little different process because we were able to utilize our same license. And so the process went very quickly. We just added a service location. So we learned along the way.
Yeah.
We learned how to work various forms of business, entity, and startup so that we could get to taking care of patients quicker. So those two expansions are really huge, and the challenges are that we have to hire hundreds. It's good for the economy. We're creating new jobs. However, it's so tedious to start serving the areas, and while at the same time we're opening our very first West Pasco inpatient freestanding care center, 24 beds, and the construction is done. We passed our inspection. We're waiting for that license. So that's another 60 to 70 employees with all the resources, the medications, the physicians, and while it's very exciting, we want to maintain our standards of care, hire the best people, train everyone that needs to, and then just do it the right way, do it the Gulf Side way. So, but our team can do it.
Do you sleep?
I do sleep sometimes, but I'm up. I'm an early riser. I'm up at 4 a.m. every day. I think what helps me is I get to the gym at 5 so that I can really, get my endorphins going and have a productive day. I just thrive on that. But the biggest thing that keeps me up at night is just making sure that my team is safe, that they're happy, that they're, provided the best benefits and care and service, that they feel valued. And as we grow, we now have over 500 employees.
It's amazing.
We had 30 employees when I first started and less than 30 patients, and we're over 1,200 patients in total. And so, that's what I just want to make sure that I'm not, my eye is on the ball for taking care of the team, because then we could take care of the patients.
I appreciate how much you've grown. I know you're treating the patients who have needs and the families, but I don't want to forget about everybody that you employ and the fact that they're able to then provide for their families. It's really difficult to find a job, especially for the cost of living that it is where we are, that provides financially enough to support a family. And the fact that you're able to expand that and provide employment opportunities to more of our community, in addition to serving the families and the patients, to me matters a lot.
I completely agree with you, and that's, so intuitive of you and really perceptive and right on target with what's important to our organization, and that is to stay highly above the market wage for every single position, whether it's a housekeeper, a certified nurse's aide, or a physician. We want to attract and maintain and retain the best staff. So we've got to be competitive. We do wage analysis throughout the year on all positions, to not only hire people at the rate, if because that's one of the things that's the most important. But in addition to that, I think Gulfside has been very proud about the fact that it's pretty much unheard of, but Gulfside pays for over 80% of each employee's health insurance premium.
Amazing.
And as we've grown, we have not wavered on that. So that really helps, providing robust and creative benefit packages. When you're a nonprofit organization, there's not, the ability to, be a shareholder. So we've got to find those things that make it equitable for someone to, want to stay. And then really growth, promotion, build your career at Gulfside, because we're going to continue. So all of that, I think, is a culmination of what we try to focus on every day, because healthcare is hard. There's still I think countrywide, there's a 12% shortage in nursing. And so in Tampa Bay alone, I think we're short like 40,000 nurses. So,
It's amazing.
we
It's
try to maintain.
crazy to think about.
It's crazy. But I do love to take care of our team, As a matter of fact, tomorrow or Thursday night, I rented out the Florida Aquarium for our employee holiday party.
Love it.
And I think we've got about 530 people coming. So those little things matter to people.
They absolutely do. One of the things I was so impressed about when you and I had lunch together is you shared with me that you didn't want people to look at you as a stepping stone.
Right.
You wanted to bring them on, allow them to grow in their career, and that they would want to stay. And that is a beautiful. I want everybody who's thinking about looking for a job in healthcare to consider this conversation when you're out there applying. That matters because a lot of them are revolving doors. They're just on to the next thing, on to the next thing. The fact that you do get creative. I remember you talking to me about standing in line and giving turkeys. And I was like, that's amazing. Like nobody does those things, and those things matter. They create a culture of inclusivity and respect. And it is really difficult for those, especially healthcare providers, to feel that way at, I wouldn't say the majority, but definitely at some employers.
Yeah, I mean, the word culture is everywhere.
It is.
But living the culture and being an example, I make a point to go to every single new employee orientation. And it's every 2 weeks. And whether there's 5 people or 50 people, I want to meet them. I want to welcome them. They had a choice of where they wanted to work next, and they chose Gulfside. And it's important for me to talk to people who are early on in their careers, mid-career, and maybe towards the end of their careers. There's still opportunities right at Gulfside. And, you know, when we got out of school, I think there was still the philosophy of people, you know, you heard of people staying at companies for 25, 30 years. You know, my father stayed at one company and he retired there. Well, as the years passed, that's really, and people started traveling all over, et cetera, which is fantastic. And I did that as well, too. But the message I try to really send to everyone that steps foot at into Gulfside's orientation, especially people who are just starting out their career, don't see us as a launching pad. Tell us about where do you see yourself in 2, 3 years, and where would you like to, you know, expand? You know, are you interested in creating programs? Are you thinking about a leadership role? There's so many internal and external programs we work to grow people, and they really help grow the organization. So that's part of the job that I love the most.
I love that about you. So, what is the biggest bet you've made in the last year? Something that could really pay off or really cost you?
Okay, so the biggest bet was convincing our board and putting that data in front of them to show them this is the direction for Gulfside. So every year I have seen a lot of M&A activity around hospices, large healthcare conglomerates merging with hospice providers, hospital systems wanting to get into the business, mergers between post-acute entities, large ACOs thinking about, you know, how could we have a joint partnership? And what happens if there aren't two like entities that come together? You know, mergers could be very challenging. And so it was important for me to tell the board, yes, it might cost a few $100,000 each time to apply for a certificate of need. But to remain, if the board and all of our philosophy is to remain a community-based, nonprofit, sole provider entity, then we have to spend that money. We have to put those resources out there, and we have to win the certificate of need to show the Agency for Healthcare Administration that Gulfside is a premier service provider with the best staff, and the communities here deserve to have our care. And so going from a $50 million in annualized revenue to just with Hillsborough alone, as you suggested, and then continuing those resources and that revenue that comes in from Medicare, Medicaid, commercial insurance, fundraising. We also are in the retail business with our 4 thrift shops. That sustains our organization. And there are so many more ways of diversifying for Gulfside beyond home health, hospice, and palliative care that I see in the future that will meet our mission and keep us a freestanding organization that doesn't have to be acquired. Many go bankrupt, and many are acquired, and many just close their doors. And so I think that's the bet I took, and I'm sticking to it. I think it's good. I think the odds are good.
The odds are very good. It's so interesting that that's the answer you chose. I have to tell you, Linda, every time I talk about you and what you're growing, whether that's internally with my company or I'm talking about all the wonderful things you do, like the candlelight ceremony, or talking about Carla, who I absolutely adore.
She says hi, by the way.
Thank you. I appreciate that. That's your director of philanthropy for everybody listening. I always tell everyone it's so impressive that you're doing it organically, that you're not doing it through mergers. You're not looking to acquire other businesses that already exist. You're doing it in today's society the long game way, right? The way that requires a lot more, but gives you a lot more control over your culture and your people and what services you provide, because you're never going to have to conform or adapt to somebody else's strategy.
Very true.
I think it's super impressive. So I know we talked about attracting talent, and for you, a lot of that comes from benefits and being creative and creating a path for them. How do you, when you think about attracting your very best people, what does that look like in your mind? How do you put pen to paper when you're putting out a job, like a job posting?
The posting needs to depict a thorough description of not only what the job entails, so people that are looking for certain specific positions understand exactly what's required, because you look at some postings and it takes a while to understand what the job actually is.
So true.
And so we try to do that and infuse some of that, sense of belonging, becoming part of our community, helping us grow. I love highlighting our team. I don't really want to be out there being highlighted myself. So, everything from having huge billboards of our physicians and our nurses, doing commercials where our team could be sitting with patients, and a certified nurse's aide could talk about why he loves being able to provide that care. So I think just really sharing the experience of working at Gulfside with the team and hearing from them, in addition to a job posting, are some of the strategies that we utilize.
Yeah, I appreciate that very much. I do agree with you. Most job postings, it's like 3/4 of the way before you even know what they're looking for.
Yeah.
And I'm like, and then you're still not exactly sure what the job is.
Yeah.
You're like, I don't know what I'd be doing here.
I know. So I work with our chief human resource officer, and we talk about all the buzzwords and HR and all that good stuff. And then, job posting is created. And I said, well, but what is that job?
Yes.
Let's make the title stand out, so someone that's looking for that specific job sees the words that mean what the job entails.
Yes.
And sometimes it's very simple, but we forget that.
Yes.
So
We're trying to I do agree. We try to overcomplicate things for sure. So opening new care centers, expanding services, what keeps you up at night from a risk perspective?
Home care, hospice care, palliative care serves patients wherever they call home. We have care centers, but all across the country, there's 5,000 hospices. Less than 1% of those hospice patients go to a care center. And in home care, it's exactly what it is. It's in their home, right? Palliative care, we have a few clinics, but we go to people's homes. So what really keeps me up, in addition to a lot of other things, though, is making sure my staff is safe. They are going into all socioeconomic areas of counties. They are serving patients that are homeless. They are going to remote locations late at night. 24/7 is our service call. We do admissions at 2 a.m. if there is a need. And so how can I keep our staff safe, and what types of initiatives do we put in place that are continually thinking about 400 or 500 employees out there, and at least 100 late at night while I'm sleeping or trying to sleep, because those things are very important. Years ago, we had to start utilizing security systems, security companies in our care centers. Never thought we had to do that.
Yeah.
But the local police and the county sheriffs, they've also come to all our locations, all of our administrative offices. They've partnered with us to help train our team as to what to look for. And we never force anyone to go into any kind of home if they feel, concerned about it, unsafe, or worried. We'd rather them just say, let us know, call us. If you don't feel comfortable, that's okay.
Yeah, I appreciate that. That is something a lot of careers and industries have to worry about. I mean, you think about even somebody coming to fix your alarm system, and it could be the inverse. The families could also be worried about who's coming to their
Correct.
home.
Yeah.
So you always think about that too. What are you most focused on protecting as you grow?
Our reputation,
Love it.
absolutely. Our standards of excellence, and always making sure we just do the right thing, and serve people in need, and just share that compassion. I think that you can train people on the basics of medication management or, physician oversight, but bringing people on and, letting them know that we have high standards. And so, we're good to you. We always want to take care of you, but you also have to understand that, we expect excellence and the best care possible. So I think keeping that and maintaining that, and then just working with all of the community partners, whether they're hospitals, nursing homes, assisted living facilities, helping them with their pain points. And that really helps us serve the community together. And so I think that continues to preserve your reputation in the communities and beyond.
I believe you're my 6th interview, and you're the 3rd person who's answered reputation. So reputation and relationships are like the number 1 and 2 answers, which I really appreciate. When you're making a big decision, like opening a new care center or launching a new service, who's in the room and how do you decide when to pull the trigger?
Okay, so we have an amazing governing board. It consists of volunteers from all walks of life, all industries. And so they have really been at the table where I've pushed a lot of strategy in front of them over the course of over 21 years now at Gulfside. And, years ago, it was very important to educate the board of directors on how healthcare really works, how we are reimbursed, how we are regulated, and why strategy is so important. And in the earlier days where we were smaller, it was scary. But through the years, they've come to trust and know. I mean, I don't get all yeses, but the majority of the types of strategic initiatives we put forward, I work with the board to understand why it's important for Gulfside. So they're in the room. I have a wonderful leadership team. So it's not just me at the helm running the show. It's about 30 people, from managers to directors to vice presidents to officers, that work together in tandem to peel problems back, to look at process improvement, to create strategy, to take a look at years where we have to lean out, or years where this is a good growth year, this is a year for initiatives. And then, like you said earlier too, the Florida associations, the state associations, the national associations, there's so many resources available. But those are the key players. I make sure for me that I always have a coach. So I work with I've been a Vistage member for many years. I belong to executive CEO groups that I feel is keeping me abreast of other parts of not only the healthcare industry, but other industries, because we have the same types of challenges. But working with someone that's a owner of a pallet company, for instance, is just tremendous to hear how he or she might work through business decisions, HR decisions, or what have you. So I have a wide range of mentors and networks that I seek guidance from and put strategy in front of.
Yeah, I love that. I am a massive proponent of diversity of thought. So the fact that you said you have 30 leaders plus your governing board who are volunteers and come from all different backgrounds, I already know that's a huge reason why you have been able to sustain the excellence that you've sustained, and why you won the certificate of need. I think having a lot of different frames of mind and different experiences is massively important for monumental growth.
Yes.
Uh,
You know,
huge to
having
me.
mentors early on in careers, it could go one way or another. And I feel very blessed and fortunate that when I was in the countrywide corporate world, with, worrying about shareholders in the stock market and growing in the business world, I still felt heard. I was one of 30,000 employees at one of the companies I worked for, but that's where I really learned business, finance, learning how to become a strong leader. And I had strong mentors. So I always hold on to that as we grow, knowing that it's still possible. It's possible to maintain and walk through a journey of growth and still, know your employees and reach them and listen to them.
Beautiful. It's great that you had that experience because it might not have felt as possible if you didn't experience that firsthand.
Maybe not. Yeah.
Because that is a lot of people to still feel like you are an individual. It's amazing. Whatever company that was, kudos to you. So what trends are you paying attention to and how are you positioning Gulfside to stay ahead?
I'm watching the trends of, first of all, we run a business, okay? So we may have $70 million in annualized revenue, but 65% of that is going to go to compensation, okay? So, you still have to make what's called a surplus in the nonprofit world so that you can, have a cash flow, strong balance sheet, be, aware of and able to sustain your business if, let's just say, Medicare stopped paying, end of life care. What happens then?
Yes.
So I'm always thinking about what could change the scope. And let's just say there were a 5% decrease in Medicare next year. Okay, I know exactly what that, calculates to, and how do I have the resources to support that, and how, if it stays that way, will we sustain business? So I'm always looking at diversification. I was in the long-term care field for a long time. I was a nursing home administrator, ran assisted living facilities. The senior population here in the Tampa Bay market, there's so many services that still are available to be provided, and so I'm always thinking about what's next for Gulfside. But I will tell you, for the next couple of years, I think we're good. Between the Care Center, Hillsborough,
Yes.
Pinellas,
And your retail stores.
and the retail
Yes.
stores, our thrift shops are amazing. They're well-oiled machines. They bring in close to $3 million of revenue a year.
It's amazing.
And it's all donated inventory from most of the families that have been served by Gulfside in one of the 3 service lines. And then the majority of the people that work in the shops are volunteers. Many whose loved ones have received our services or died on our services. And so we can create strong margins there because the biggest overhead is leased space and a little bit of salary. And so what we bring in fundraising dollars and thrift shop dollars goes back into programs that we are not reimbursed for, such as the Candlelight Memorial, the Children's Camp, bereavement programs, specialized clinical, service programs, fellowship programs, internship programs, things that we're not reimbursed for. And we pay for every patient's medications, supplies, equipment, and that's not part of our reimbursement. So we have to make sure that we're staying fiscally strong from a business perspective, but I see high potential for Gulfside. I really do.
I love it. So I have a signature question I ask every guest as the last question. So what is the one play you believe that every business leader needs in their playbook?
Take very, very good care of your team, know your market, and follow the blue ocean strategy. I'm highly competitive. I'm never afraid to ask. I love to close deals, all that good stuff. But you need to know you need to know your competition and understand what differentiates you, and not worry about them. Just follow the blue ocean strategy. Keep going. Make them irrelevant, and you're going to grow your business.
That is great advice. That is awesome advice in sales also. So whoever is listening to that. So Linda, thank you so much for being here. It's a pleasure.
Thank you so much.
Yeah, I can't wait to come see your facility.
Oh, yes,
yeah,
please do.
Maggie and I will definitely take you up on your offer. So Linda Ward is proof that you can build a business that scales without compromising the values that made you successful in the first place. 40 years in healthcare and still expanding, still innovating, and still leading with her heart. Here's what I want you to take away from this conversation. First, sustainable growth requires both courage and calculation. Linda's not expanding recklessly. She's placing strategic bets based on years of experience. She knows the difference between a growth opportunity and a costly distraction. Second, innovation in mature industries isn't about reinventing the wheel. It's about improving how the wheel serves people. Linda's innovations in care delivery are grounded in operational excellence and a deep understanding of what patients and families actually need. And third, the businesses that last are built on values that don't compromise. In healthcare, quality of care isn't negotiable. Linda's entire playbook is built around that non-negotiable foundation, and everything else grows from there. 40 years in the game, still expanding, and still leading. That's what championship leadership actually looks like. Next week on the Policy Playbook, we're talking with E.J. Pipkin, founding partner at Extra Mile and the financial advisor who wants to be your quarterback. E.J. brings more than 20 years in financial services plus 10 years as a Maryland state senator, and he specializes in the complex plays, the financial challenges that require a full team approach. We'll dive into his playbook for coordinating financial strategy, building wealth that lasts, and why having the right quarterback for your money might be the most important play you ever make. You won't want to miss it. This has been the Policy Playbook, smart strategies, straight talk, and zero BS. After every episode, I'll send out the Policy Playbook newsletter where I break down what you just heard and give you specific strategies you can actually use. This week, I'll share key insights from Linda's approach to expansion, innovation, and building sustainable growth in healthcare. Subscribe now. The link is in the show notes. If this resonated, please share it with a fellow business owner and subscribe to the podcast so you don't miss what's coming next. Until next time, let's build your playbook.